Welcome back, everybody. We managed to conquer part 1 of Unit 1, and now we're going to move on to part 2, which, as you can see, is the abdomen portion of this unit. The process is going to remain the same. There's not going to be anything new that you have to be aware of. We're going to follow the same guide and principle that we did in part 1. So, here in just a moment, we will get started with that. All right, here we are. We are into our abdomen images now. We have our first one up here. Um, so just like the chest images, we're going to dive right in. We're going to start at the top and work our way through it. So let's take a look here. All right, number 1 is all required anatomy present in the exam. Yeah, absolutely, it sure is. If we start here at the top and get us a little mark and put another one at the bottom. For a complete KUB, we know that we must include the kidneys, ureter, and bladder, and the anatomy that's present in between. And, of course, not miss anything in the lateral aspects of the abdomen. And we have accomplished that in this image. The bladder is fully present. We know that because we can see the pubic symphysis in clear detail. And then on the upper portion of the abdomen, we have the margins for our left and right kidneys, and the margin for the presumed left kidney is right in this area, and then the presumed right kidney is right there. And then of course we know that the bladder is in this area here, and then ureters make their way down into the bladder. So yeah, absolutely, we have exactly what we want to see as far as required anatomy. So yeah, we hit the nail on the head there. Moving on, is the anatomy properly positioned? Well, we'll throw our lines up there like we did with the chest x-ray and see how that works out for us. Let's see. That one wasn't very straight, but we get the idea. So from the mid-sagittal sense, yes, this image is absolutely aligned properly to the IR. It is centered very well. The only thing I would say is it looks like perhaps maybe the patient's shoulders kind of favored the left side just a little bit, and that's because there appears to be on the lateral margins a little more space on the presumed right side than there is on the left. So not really a detriment to this image, but it is apparent. Inferior superiorly, if anything, I believe that the image was perhaps centered a bit high, but once again, the required anatomy is present, so while it's not a detriment for this image, it does appear to have been centered just a bit high. My lines aren't perfect, we know that, but just what we can see with our rough estimates here. So yeah, south just a little bit towards the patient's feet, maybe about an inch, inch and a half would have been perfect right there. So, but other than that, the positioning for this image is very good. Moving on, does the image demonstrate adequate exposure properties? The contrast for this image is very good. It's very, very good. We're able to see all of those margins for our soft tissue organs. We already covered the kidneys. We have even a bit of the liver margin right here on this side, in this area, is what we see right there. And then also visible with our within our image are the profiles of our psoas muscles right here, which are a vital part of a good KUB, being able to visualize those, and they are visible there in this image. We have the ability to determine bowel gas in different regions of the KUB. So we definitely got real good contrast. The brightness looks good. I think the technique that was chosen for this image was very adequate. Absolutely. Okay, moving on to number 4, is the image free from artifacts? Now this one's kind of a trick question, I guess you could say. So what do you think? Is it free from artifacts? The answer to that is yes and no. Is it free from external artifacts like clothing, folds in the clothing, or equipment, or keys, or dimes, or anything of that nature? Yes, it's absolutely free from external artifacts that could be removed. However, it does have some internal artifacts which we can't actually do anything about, and those are in the form of the bowel gas in the patient's belly. It, as you can see, causes a little mottling obscurity right there on the right side in that pelvic wing, and then on the presumed left side as well, there's a little bit. And so then if you notice, it's also very apparent here in the area of the coccyx in the lower part of the sacrum. That bowel gas obscures that quite a bit, and so if there were some, lower abdomen pathology that was of some concern, this could potentially obscure it. Now, as I said, this is not something that we can really do anything about, as bowel gas is present every patient. But just keep in mind, of course, that if this were a patient that was being scouted for like a fluoroscopic procedure, make sure that patient had followed their preparation guidelines correctly, and because this is what you want to try to avoid if you're getting into one of those kinds of procedures. But, okay, so is it free from external artifacts? Yes. Internal artifacts, just the bowel gas. But as we know, there's nothing we can really do about that, but we must make note of it. Okay. And finally, does the image demonstrate appropriate reference information? Well, there's an object here that is not a true anatomical marker. I'm not sure what that was supposed to indicate, but it does not help us as far as reference information for this exam. We do have, of course, our partial patient information, and that is right here. We have a name and a birthday. We know that we need a medical record number as well to really kind of help us identify that patient, or rather, I should say help the doctor identify that patient correctly and make sure the exam goes with the correct patient. But okay, all right, well, that's our first belly analysis image. And here in just a bit, we will move on to our next one. Now, this one was pretty straightforward, not a whole lot to talk about, but hopefully some of the slides in the future hopefully will be a little more interesting than this. We'll get into some neat stuff, and we'll do that in just a moment. All right, on to our next image. Okay, well, once again, we have an abdomen here. Pretty obvious that, isn't it? Yeah. But anyway, we'll just jump right into it like we always do and start from the top. So, is all the required anatomy present in this exam? Well, we definitely are able to identify the pubic symphysis, and then some. So And as far as the inferior aspect of this image goes, yes, we have all of our required anatomy. It is present on this exam, absolutely. As far as the superior aspect of the image, so we have some of that bowel gas obscuring going on. And it makes it a bit difficult to identify for absolute certain where our kidney margins are. As best I can tell, there's a part of one there, and it looks like this is the margin for the right side. So, it's a bit difficult to determine for certain on the left side if the entire kidney is present. And because of that, we cannot make assumptions. We need to make decisions based on what we do know. And what we do know is that we have quite a bit of leeway on the inferior portion of this x-ray. To err on the side of caution, the technologist should return to the patient and adjust the patient's alignment more superiorly. And we'll get into that in just a second because we're going to get into proper positioning and everything for the image. But you can see that space that we have available there that will help us ensure that the required anatomy is present in making that adjustment. And so then moving on to positioning, we'll draw our lines, and let's see. Okay, so we have our lines up. From a mid-sagittal sense, the image is very well positioned. It's pretty much dead on for mid-sagittal alignment to the IR. So very good positioning there. However, after drawing my line, as you can see, it certainly does appear that the patient was originally positioned a bit low. The technologist needs to make the adjustment to align the central ray more at the level of the peak of the crest. It almost looks like they may have been going for ASIS when they originally positioned this patient. So that little adjustment will probably alleviate our concern as to whether or not the left kidney is present on this image. All right, so as far as positioning goes, we got all that. Moving on to number 3, does the image demonstrate adequate exposure properties? It's quite possible that the contrast of this image was adjusted post-processing, and the reason I say that is because it's a bit low contrast for what I would expect to see on a KUB. There's definitely contrast visible. We're able to identify anatomical structures. Once again, there's our psoas muscles present there. We have our bladder present here at the bottom. And then, of course, the margins of our kidneys are visible there. And then even a little section of the liver is visible there on the right-hand side. So the contrast is not terrible. We are able to make some differentiations for soft tissue structures, but I feel like maybe this image was adjusted a bit after it was taken. But in the overall, it looks like the technique was pretty good. The difference between our bony structures and soft tissue is very evident. And in general appearance, it's a very clean image. Very, very good technique for a belly. Like I said, I think it was just adjusted some post-processing. Number 4, is the image free from artifacts? Yes, this image is absolutely free from artifacts. I cannot readily identify any external artifacts. Don't forget that. It is free from external artifacts. However, we still have some of that internal artifact in the form of bowel gas. Can't do anything about that, but we do need to note that it's present, and take that into account depending on what we're creating this image for. Does that bowel gas obscure the areas of real interest that we have for this patient? And we may have to try something different if that's the case. But external artifacts are not present on this exam. Number 5, does the image demonstrate appropriate reference information? As a matter of fact, this one's actually pretty good. They were very forward thinking when they created this one. We have a notation that the patient is supine, which is helpful. The radiologist does appreciate that. And we have our anatomical marker with the side indicator as well as the text initials. So good there. We have our patient name and birthday over here. So all we need is a medical record number, and we would have complete reference information for this image. Okay, so that is the program for this image, and we will move on to some more in just a moment.
All right, everybody. Well, here we are. We have another abdomen image to do some analysis on. So let's just jump right in and get started. So in this image, we have moved to an upright abdomen. And we can tell that, which this is, just kind of an FYI thing, so differentiate from our last image. But we can tell that based on these very pronounced shapes within the bowel, and that is air fluid levels. If you notice, the bottoms of these little gas-filled areas are kind of rounded. They look almost like, I guess, like little mushroom tops. Best thing I can think of to describe them, but that's an indicator that fluid has settled in the bowel and that the air has risen to the top. So this is an upright abdomen. So with that being said, our big question is, of course, is all the required anatomy present on this exam? And we'll just get up here and make us some little get us some little spots. There we go. And then down here on the bottom, just reference lines, of course, so that we have something to visually adjust to. So with an upright abdomen, we do know that it is pertinent that the diaphragm be included on an upright abdomen, because just as we can see there in the bowel, we are going to evaluate that area for air fluid, air above the diaphragm, which is an indicator of pathology being present. And so the diaphragm must be included, and we can see across the upper abdomen here, there's the bottom of the lungs, the lung bases, and we have lung visible above that, right through there. So yes, we did get the entirety of the diaphragm in this image. And then, of course, this patient was, I would have to say, probably a little on the smaller side, because the entirety of the abdomen and pelvis is visible in this exam. With an upright abdomen, of course, we want to get as much as possible, but this one was exceptional because it does include the entire abdomen. On the lower portion of an upright abdomen, absolutely must make sure that the tops of the crests are visible to have a diagnostic upright abdomen. Must at least include that much. This one's good. This one's really good because it has the whole belly in it. So yeah, as far as anatomy goes, this one's excellent. All the anatomy is present. Really good on that aspect of things. Moving on, is it properly positioned? Well, we'll throw our little reference lines up there. Sorry about that one. It is a bit crooked. That one just come across there. All right, so with an upright abdomen, we do want to have about 2 inches above the iliac crest to ensure that we do get that diaphragm. And just as a a visual guess here, I'm going to say that is definitely about 2 inches there. And so, yes, as far as positioning, this image was positioned very well. I don't see any evidence for rotation. I think there is a little twisting in the patient's spine. That could very well be congenital or, pathological over time. I'm not knowing for certain this patient's age. But as far as everything else, it looks to be very well positioned. I don't see any other evidence for rotation or anything of that nature. So moving on to number 3, does the image demonstrate adequate exposure properties? The contrast on this is wonderful. It's excellent. The air fluid levels are readily visible. We actually, if we look here, we can identify some kidney margins, like right in this area here, and then I believe this is the presumed left side over here as well. So being able to visualize those aspects is a very good indicator that your technique was good. We also have the that profile, the psoas muscles here on both sides bilaterally, so that's good. Definitely something that you want to see. And yeah, and overall the exposure properties for this image were very good. Excellent choice of technique for this exam. Number 4, is it free from artifacts? Yes, it is free from artifacts. One thing in terms of anything that would be detrimental to the image, one thing that I would like to point out, something you may not have seen initially, here in the corners, right in there, and then of course right over here. If you look, I'm going to take those off real quick so that you can see it again. I just wanted to bring your attention to that area. Let's see. There we go. And then there. Okay. Let me move that cursor. If you look in those corners there, those are the corners I wanted to show you, you can see what appears to be the shadow of what's probably the patient's hands. Just a cautionary note, as you can see, the patient's, especially hands, have a tendency to work their way into images. So absolutely always make sure you know where your patient's hands are before you make an exposure, because I promise they're not even going to think about it. They're going to move their hand right back into the field of view. And so you just have to really hammer that, specification in when you're doing your exams, that they cannot move their hands, because as you can see, it doesn't take much before they creep into your picture. So lastly, of course, does this image demonstrate adequate reference information? Well, and we know just by looking here that we have partial. We've got name and birthday there, like our previous images. There is no anatomical marker present on this image, so all of our laterality assumptions are just that, assumptions. As we all know, anatomical markers so very important, but we can note that there is a partial patient reference information, but we do need the, as we know, medical record number to make it complete. Okay, we'll move on to our next image in just a moment and keep this rolling. All right, everybody. Well, just a little heads up. This is our last image for this unit. Hooray, right? Yeah, I know. We've really put some time into this, and hopefully it's starting to make some sense for you guys as far as the process and what we're trying to do here. So let's just run through this one and get it done, and then we'll be ready for some new stuff shortly thereafter. Okay, so starting with number one is the required anatomy present on this exam. Well, taking a look at this image, my conclusion is this is a supine abdomen, and the reason for that is because I cannot readily identify any air fluid levels. I see a lot of bowel gas and stool, but it has, for example, let me point this out. The stool visible in this image, if you notice, especially here, is centralized to the medial area internally of the bowel, which would indicate that it's not sitting on the bottom as if the if the patient were standing up. It's just located centrally. So that leads me to believe that this patient is lying supine, and that the stool material, the fecal material, is actually resting against what is the posterior aspect of the intestinal wall there. So yeah, this is a supine image. So with that being said, is all of our anatomy present? Well, kind of difficult to say in terms of kidneys, and the reason for that, this is really kind of what I wanted to touch on when we began this unit for artifacts. We'll get to that in a moment, but yeah, definitely not easily or readily identifiable kidney area. I don't think there's any helping that. You're not going to be able to make too much of a determination about that. One thing we can tell, though, is that the entirety of the bladder is not included. And we know that because we cannot identify the pubic symphysis on this inferior portion of this image. So, no, the required anatomy for this exam is not present. It does need to be repeated to include the full bladder, full portion of the bladder. Positioning. Well, let's draw some lines here and see what we can come up with. And right through there, yeah. And so as you can see, it looks to me, mid-sagittally, the image is positioned well. It's favoring the left side just a bit. Fortunately, it did not cut off any pertinent information in terms of internal structures of the bowel. We can't get a real good look at the lateral portion of that left wing of the pelvis there, but fortunately, we are able to identify all of the soft tissue areas and margins. As I said, this image does need to be adjusted inferiorly just slightly. I think that when they made their central ray alignment to the image receptor inferior superiorly, they went just a bit above the iliac crest, and that's where we got that cut off on the bladder. So that needs to be adjusted, and the image will be good for positioning. Now, Moving on to number 4, does the image demonstrate adequate exposure properties? The contrast for this image looks fine. Differentiation between bowel gas, bowel stool, bony structures, it's all readily discernible. Contrast for this image is good. I don't think the technique was bad or a poor choice. I think that was done very well. Um, Number 4, is the image free from artifacts? Actually, no, on both the external and internal aspect of artifacts. Internally, we have this monumental amount of bowel gas, bowel stool, and it has just pretty much taken over the entire upper portion of the belly. All of this area here, of course, is bowel gas and bowel stool, and it has really obscured some of the other soft tissue structures within the abdomen. However, there's not a lot we can do about that. If anything, this particular patient's probably in a pretty good deal of discomfort because of that fullness. But that's probably a part of why they're getting an x-ray, is to determine what's going on there. Uh, but yes, internally we do have some interference from that bowel gas uh, and stool artifact. Externally, we also have an external artifact as well. I don't know if anybody noticed it right away, but the technologist did not ensure that some of the patient's garment buttons were fully out of the picture. And so right there in those areas where I circled, we have probably a rivet on the jeans. That looks like a button from somebody's blue jeans right there. And then perhaps another little rivet over here, some decorative something perhaps on the image. So internally and externally, this image is not free from artifacts and should be repeated to remove those. The ones that we can, obviously. And then number 5, does the image display uh, correct reference information? We have an anatomical marker, which is great. We like seeing that. We definitely need those, and we have a name and birthday, so we have almost a complete set of reference information. Just need a medical record number to help fill that out and make sure that the image is diagnostic. Okay, guys, we have one more slide, and then we'll be done with Unit 1. Okay, everybody, here we are. All right, well, we've got several things we're going to cover with this particular image. A lot of things that we can talk about. First and foremost, um, just in an overall glance, I'm going to say that this patient is probably in a pretty critical condition. Um, and we'll get in a little more into that in just a moment when we start talking about demonstrated anatomy. But first and foremost, of course, is all required anatomy for this image present. And I'm going to say that we uh, make our little reference marks there, here, and here. So we know that for a supine image of the abdomen, it must include the bladder in order to be fully diagnostic. Now, the aim for this particular image when it was taken may not have been just strictly a routine KUB. In fact, I think it's pretty safe to assume that it was not. However, we can still critique this image on the basis of what is required for a complete abdominal study. And this does not have it. As we know, the inferior most portion of the bladder must be present on the image, and that's identifiable by the presence of the pubic symphysis in the image. And this one is not. If anything, we have about perhaps half of the upper portion of the patient's pelvis present in this image. So With that being said, we do have a notation in the lower corner indicating that this was a semi-erect study. And going off of that, if that were the case and we were concerned about something of that nature, then we can come up here and just kind of get a little reference line going there. So that's the approximate area of our diaphragm. The entire diaphragm is also not included on this image. The left side is mostly included. The right side has the lateral aspect of the diaphragm missing. So argue it whether you want to say it's a supine image or it's an upright image. It's indicated as semi-erect. Either way, pertinent anatomy is missing from this exam for either study. So it's not acceptable. This image would honestly need to be repeated in most cases. As I said, this image may have been taken strictly for a different purpose, but we can still critique it. Moving on, is the anatomy properly positioned? Well, we'll get our reference lines here. Straight on down, and then about the middle. Yeah, somewhere right around in there. Okay, all right. So from a mid-sagittal standpoint, it's pretty obvious that the patient shifted pretty far to the right in reference to the image receptor, which has given us that very dark area on the left-hand side. Over here, we have all this extra space that we do not need. In fact, we need more of the right side of the abdomen because the right side of the abdomen is missing on this image. So yeah, the patient is not centered correctly to the image receptor. And then in terms of inferior, superior, if you look at my reference line, it's relatively close to the middle of this image, and they did not. I'm going to have to guess that they used the inferior portion of the ribs as a centering point for this exam, and that didn't work out so well. As I said, anatomy is missing from both aspects, supine or erect. The diaphragm's not included in its entirety, and then of course for a supine image, the inferior aspect of the bladder is not present. So the technologist should definitely return to the patient and adjust the patient to be aligned in the mid-sagittal plane to the image receptor, and make a decision if they're going to make this image upright or supine oriented, and then center the image receptor inferior superiorly according to the landmarks for that exam. So they need to make a choice there, and it's the corrective actions to do so. Moving on, let's see. Does the image display adequate exposure properties? The contrast for this image is really good. We have some anatomy that is readily visible, things that we would expect to see in this exam. The inferior margin of the liver is present there. I really can't note too well the both psoas muscles. I believe that's a kind of the profile of one there. The upper portion of the right one may be in this area here. But that, of course, have to do with the positioning and the choice made for this image as far as that's concerned. But as far as visible structures, the contrast is definitely there for this exam. Number 4 is the image free from artifacts? Well, here's where we really get to, dig into things. Both external and internal artifacts are present in this exam. The main concern for this picture, I feel, is most likely this, what is probably a DIPOF tube or NG tube here in the patient's upper abdomen is probably the main focus for this study. That is an internal artifact at this point now because it's been placed inside the patient, and there's not a whole lot that we can do about that. In terms of other internal artifacts, this object here has the appearance of perhaps a shunt, that originates in the patient's brain and then empties in the abdomen. I'm not certain. That's a pretty unique artifact, and it's not one that I can say I've seen very often. So I am going to venture a guess that that's what it is, or it is the largest vessel graft I've ever seen in my career. Regardless, it is most likely internal, and there's not a whole lot we can do about that. However, there are a few things that we could have changed that would have helped in the appearance of this image. And the main ones, of course, my line got a little crazy there, but I think you see what I'm going for here. These EKG leads are moving across the upper portion of the belly, and it really does kind of obscure, especially this one that goes all the way across the belly. It does obscure anatomy and is not desirable for this image, and they should be removed if at all possible. So that is a definite must. And this, while of course we have to commend them for their effort, this here is definitely not good. Our anatomical markers actually located in the area of pertinent anatomy, and we don't want that. The anatomical marker should always be placed in an area where it will not end up in pertinent anatomy and cause obstruction like this. So great that there's an anatomical marker that goes into our reference information, but bad placement, as well as placement for the digital indicator that they put in this. The real marker is here, and I believe this one was added digitally afterwards, and they put both of them in a region that would be of pertinent interest. So definitely need to avoid that. And then on to number 5, of course, is reference information present. Yes, we have a good deal of reference information. Of course, we have our anatomical marker, which is a rarity, it seems. So that's a good thing to see. They did give an indication for the radiologist that the image was performed semi-erect. Also important, the good information for the radiologist. They like to know those things. And then, of course, we have name and birthday, with the absence of a medical record number, which would make our image complete. All right, with that being said, we have completed the analysis for this image, and we will move on to some more in just a moment. Okay, moving right along. We have a new picture here, and some important things that we get to talk about for this image. First and foremost, let's make that determination about anatomy. Is all the required anatomy present? Well, get our reference markers. And I like using these because it gives us an idea of the parameters of where we're looking and the in-betweens, what's in between those areas that we want to see. So just another visual clue that we're dealing with an upright abdomen. In all honesty, is actually the only clue that you get that this is an upright abdomen, and that is a very, very, very pronounced area of air fluid in the patient's stomach right there. A little half moon area right there is where fluid has settled in the belly, and the air has risen to the top, and so that's what gives that, like I said, that half moon area right there. So this is an upright abdomen. Of course, when we really dig into visible anatomy, we'll get some other clues to that. And one of those is the presence of the patient's diaphragm. It's fully visible on this image, with the exception of a tiny area on the lateral aspect of the right side there. Just a tiny bit of the diaphragm that's not present. And then as far as the inferior portion, this image is adequate for an upright abdomen. It does include the iliac crest very well. Actually, about the top half of the patient's pelvis and the area of the bladder is included there. So good choice there for this exam. So yes, we have the pertinent anatomy we need, except for that small portion of the diaphragm over there. This one's really close. Arguably, of course, as a new technologist, you want to be critical and really strive to get that really great. I can't say perfect because nobody's perfect, but that really great image. So knowing that all you had to do was shift your patient slightly to the left to get a near perfect image, it would be worth repeating for this. So moving on to number 2, is the anatomy properly positioned? We'll get our midline here. Whoa. So I changed to a different computer, and I'm getting used to the movement here for this cursor. Now my line's not really helping us a whole lot here, but I can tell you that in terms of the mid-sagittal plane, the patient is shifted just slightly to the right. Unfortunately, it was enough to clip that lateral aspect of the lung there and that portion of the diaphragm. But that would correct that problem would be to shift the patient back to the left just slightly, and they'll be properly aligned to the mid-sagittal plane. Inferior superiorly, it looks to me as though they got the 2 inches above the iliac crest. Looks like they got that just dead on. I mean, it's really really well positioned there as far as that's concerned. So just that slight issue with the mid-sagittal plane on the positioning. So number 3, does the image demonstrate adequate exposure properties? Now this is where we're going to get into I guess you could say the biggest issue with this image. Looking at the lung fields, noting how dark those areas are, as well as taking a look at the rest of the patient's abdomen, with the exception of a bit of bowel gas here on the right side, as well as perhaps a small portion there, and then the stomach, there's very little to discern about the rest of this patient's belly. And that is quite possibly due to the image being underpenetrated. The spinal column's present, but not in great detail, and this is really kind of a high contrast situation. So it leads me to believe that perhaps we were dealing with a lower KVP than we would typically use for a belly, and perhaps even a lower mass, because it is in the central areas definitely very diffuse as far as the contrast is concerned. Um, on the other hand, the darkened areas in the lungs could also be an indicator that the the image has been adjusted uh, post processing to lighten those areas of the belly to create that look. But to me, the exposure properties for this image are off just a bit. If there was an adjustment made, it needs to be reset. Because the differences in the tissue in the central portion of the belly are they're definitely off a little bit. They're very diffuse, and there's very little detail that can be determined about the rest of the patient's belly. Um, Moving on to number 4, does the image demonstrate any artifacts? No, I cannot readily identify any artifacts in this image, external or otherwise. I don't see any skin folds or perhaps one area right here along the inside of the cursor. That could potentially be from a skin fold or perhaps clothing, but it's very, very minute. So artifacts, the image is definitely free from those. Number 5, does the image demonstrate appropriate reference information? Well, we have, once again, an anatomical marker, which is great. We're wanting to see those. It's unfortunately not a complete anatomical marker. It doesn't include the technologist's initials, and that is pertinent. We do need that to be present in order for this to be a fully diagnostic exam. And then, of course, we have our patient's birthday and name, and we just need that medical record number for it to be complete, and we've noted all of that. So we know what we need to do to correct here and to get this image in tip-top shape. All right. So here in just a moment, we will move on and get ourselves some more analysis going. All right, gang, here we are. We've got a new image to take a look at and critique and go over and all that good stuff. And man, what a picture we have. All right, well, so one thing I will note before we get started with this image is I have to admit that the quality on this image is not the best. However, there are some things that we can still critique from this image that we need to be aware of. So, going from the standpoint of whether or not this is a supine or upright image, I believe that this is an upright image. And the reason I say that is because if you take a look here, you see this very pronounced kind of bowl-like area. And then above that we have, and here once again, in this area right here across the bowel, right in that area, it appears to me to be fluid settlement, and of course the air up above that area leads me to believe that this is an upright abdomen. We don't have any indicator otherwise, but that is my belief. And so let's just go through our checklist. And like I said, I realized that the image quality is not that great here, but we're going to we're going to give it our best shot to tell everything we can about it. So in terms of an upright abdomen, is all the required anatomy present? This is going to be yes, but it definitely could have had some adjustments made that would have made it a much better image. Number one, with an upright abdomen, we do have to make sure that the entirety of the diaphragm is present, and of course the diaphragm runs right through that area there. And so the diaphragm is present on this image. However, the presumed left side, and the reason I say that, let's just go over the anatomy real quick, and then we'll talk about that. So here on the presumed right side is the diaphragm is just barely visible at the top of this image, and so while it is present, it's not exactly ideal. You'd like to have a little more information available than that. But through the inferior aspect, goes all the way through the pubic rami, so the entirety of the bladder and the lower portion of the belly is present. All the anatomy required for this image is present, absolutely. So moving on to whether or not it is properly positioned. It looks to me like, as you can see my reference line here, it's not a real great shade of yellow for this image, but right through here was the inferior superior central ray reference line, and it looks like it's very, like, basically right on top of the iliac crest. So they were a bit low. I think they actually probably got lucky in this case that they were able to get the entirety of the diaphragm on that presumed right side. Now you're probably wondering why I'm saying presumed right side when we have an anatomical marker here. This marker, it's a bit difficult to tell, but it almost to me looks like it might be reversed. So if that's the case, this image has been presented wrong. That marker should be on this side in the presentation to indicate the right side. And so at the same time, however, visibility on this side is not great. Could be due to the breast shadow, but I do not see an area of gastric air, which would indicate the stomach being here. We do have a lot of air here, but it would almost certainly probably obscure that. But my concern is that this image was marked incorrectly, which is possible. But just keep that in mind when the reason I'm saying presumed right and presumed left is because I'm not certain that this image was presented correctly or that it wasn't marked incorrectly. Mid-sagittally, the image is probably a slight bit to the presumed right side, and patient should be shifted back to the left just a bit to truly center up the anatomy for the mid-sagittal plane on the image receptor. So, moving on to number 3, does it display adequate exposure properties? Well, once again, the quality of this image kind of plays into this. I think the contrast is probably fine. I can definitely see differentiations between, obviously bowel gas, solid matter, more solid matter within the bowel. There's definitely identifiable contrast differences between the bony structures and the soft tissues. The spine is visible in some detail, and then of course the breast shadows are visible as well. So we have some pretty decent contrast, I think. Our quality, I think, is just because of the reference image itself. Now, moving on to number 4, is the image free from artifacts? Now, I think this is potentially also what might be playing into the quality of this image. We have some definite artifacts located here. on the presumed right side of the screen. I'm sure you saw those right away. We're just taking our stuff in order so that we can, make sure that we do our process the way we need to. Those almost look as though they are roller artifacts from a CR system. It's quite possible this is a CR image and that their equipment is having some issue. That's exactly what that looks like right there is a roller style artifact from CR equipment that caused an issue with this exam. And so also to note, it is an internal artifact, so it's not something we can really do about, but there is an internal artifact here in the patient's lower abdomen, pelvic region. From what I can tell, it looks like an IUD. Just be helpful to be familiar with those so that you don't ask the patient to remove something that they can't obviously remove. But yeah, that's what that appears to be externally. So these roller artifacts in a scenario where these are present, you definitely need to have your equipment serviced. If there's not something that you know how to do yourself, a cleaning procedure, whatever process is necessary to have that corrected, definitely needs to be checked up on, because this is very detrimental to this image and is in and of itself warrants a repeat. Even if we, didn't want to make adjustments for the diaphragm, this initiates a repeat process immediately, as this is not acceptable for a diagnostic image. So one of those things to remember and keep up with. Moving on to number 5, reference information. Well, we do know that there is an anatomical marker present on this image, but we're not entirely sure if this is accurate. As I said, this image could be mismarked or it could be presented improperly. So, and then here we have our partial patient reference information, name and birthday. We still need that medical record number to make it complete. But all right, well, that's the overall for this. Like I said, this is not in terms of quality the best image, but there are definitely some things that we were able to learn from on this picture that can be helpful in the future. All right, in a moment we will move on and get some more analysis done. Okay, well, we made it. We got all the way through our first unit. And just some ending notes as far as that goes, just some things that I wanted to cover with you. Um, as we all know, good image analysis is paramount for developing into a successful imaging technologist. Um, this the ability to do this, the more you do it, will become second nature. You'll be able to glance at an image and identify things very quickly. And it's important, especially in today's age where everything is moving so fast. It's definitely a skill that you want to work on, hone, and develop. Utilization of your analysis checklist is fundamental to hone that skill. Think about it often when you're looking at images. And as I said before, be critical. Make sure that you're being a little hard on yourself so that you really develop those skills to make sure that you can better care for your patients, provide them with good quality imaging and care. Seasoned technologists can benefit from the utilization of the checklist. It never hurts, no matter how long you've been doing this, to think about those things that you learned in this process and fall back on those and just practice those skills. And then, of course, so very important, a good technologist knows when they're in over their heads. If you have doubts or questions, about the quality of an exam, or if something needs to be changed, repeated, what happened? I'm not sure what caused that error. Whatever the situation may be, ask your peers, ask those other technologists and students that are there with you. If you have the opportunity, and it's a great one, ask the radiologist. Radiologists are excellent teachers when you can find one that's not too busy to do so. So, of course, all that being said, just we'll keep tackling more image analysis at different areas of the body, and keep working to develop these skills. As always, if you have any questions, please feel free to reach out to myself or Miss Odin. We'll be glad to do anything that we can to help you in this process. So, with that being said, thank you guys. Take a little break if you need to before we move on to the next step, and we'll see you shortly.